السلام عليكم ورحمة الله. كيف يتعامل الأهل وأفراد العائلات في مجتمع الجالية العربية الأمريكية والكلدانية في ولاية ميشيغان؟ كيف يتعاملون مع إحدى أهم التحديات التي تواجه الأبناء والبنات الشبيبة والشابات، وهي المخدرات والعقاقير الطبية التي تتوفر لهم، إن كانت أدوية بوصفات من الأطباء أو دون وصفات؟ ما هي الإشارات التي تعطي الأهل داخل العائلة الواحدة أن أبنائهم وبناتهم يتعاملون مع الأدوية أو المخدرات، يتعاطونها ويسيئون استخدامها؟ سنتحدث في حلقة هذا الأسبوع من برنامج ضيف وقضية عن أنواع الأدوية وطرق استخدامها وكيفية التخلص من هذه المشاكل قبل أن تتفاقم. ضيفي في حلقة هذا الأسبوع هو اختصاصي مكافحة إساءة استخدام الكحول والمخدرات في مستشفى سانت ميري في ليفونيا، الدكتور مايكل فوكس، اللي يعمل في العديد من المستشفيات في المقاطعات الثلاثة، وهو غني عن التعريف. أعزائي المشاهدين، أرحب بكم مرة أخرى وأنا أستقبل الدكتور Michael Fox. I would like to warmly welcome you to our weekly program, and I would like to thank you very much for accepting our invitation to talk about one of the most important challenges in our community. Thank you.
Thank you for having me.
Dr. Michael, after seeing drug-related tragedies in our community in so many times for the last 15 years or so, we decided here in this station to spread the positive word and to educate the maximum number of Arab American and Chaldean and also the mainstream about how to prevent, how to educate children, and how to reach out, and this is the most important part, how to reach out to the maximum number of people. Talk about this issue of concern to so many people in the United States of America, drug abuse.
Well, I can tell you that there's a beginning and an end.
Mm-hmm.
And when you talk about preventive measures, kids are usually using substances at a young age in middle school, sometimes at 12 years of age.
Yes.
They typically start or use cannabis, marijuana, and alcohol. If they have any type of trauma or dysfunction in the family, pain, post-traumatic stress, any type of trauma, any type of genetics, and early exposure, then they are at high risk for going on 10 years later and developing a problem where they end up picking opiates, pain pills, as their drug of choice, which ultimately leads to heroin. And that's where some of the deaths, not all the deaths, are coming from. In other words, people develop tolerance quickly. They require more of a prescription medicine. There's many indiscriminate prescribers out there. It's not just pain pill mills. There's much of this medication on the street, as there is heroin. So once a person starts having a little fun with marijuana, and the message kids get today is it's legal, it's medical, it's harmless. The early exposure changes the brain. It's not a behavior or a moral issue, it's a physical issue. It's a neurochemical issue. So once the exposure occurs, a substantial percent of those people will go on to develop a problem. Even people that drink a little more often or a little more at a time are at high risk, what we call high-risk drinkers. But typically what a person starts with is not what they end up with. The end part of that I was getting to is there's treatment available and treatment works. But there's a stigmata of this disease, and that's what it is. It's a genetic disease, where sometimes people don't want to come forward. They're not comfortable.
Especially in our community, our culture is called, ironically, the shame culture. And I would like you to shed some light and to talk maybe in detail about the type of prescription, the type of the counter medicine that is used and abused by teenagers in the home.
Okay. Well, the first thing I want to tell you is when it comes to the shame issue, everybody has it.
It's not only in the Arab Caribbean. It's not the ethnic home.
In fact, Many physicians, nurses, firemen, policemen, professionals, they don't like to come forward. A lot of people don't even know they have a problem.
Sure.
So that's one thing. The second thing is that the things that are available in a home are typically sedatives, which are tranquilizers such as Xanax and Klonopin, Vicodin, Percocet. These are things that often parents keep in their medicine cabinet. It's not hard to get these from a doctor. Doctors are sometimes indiscriminate on how often and how much they prescribe. And now we are reaching out to doctors to become educated about the high risk of treating pain.
Sure.
There's a lot of doctors that think they're treating pain, but in every doctor's office, if there's 10 people in the waiting room, at least 2 of these people are having a problem with some type of substance.
Okay.
It may be alcohol, it may be pain pills, it may be tranquilizers. So prescription medicine, it's pain pills and it's sedatives that are abused the most. When it comes
Any particular kind of painkillers or cough medicine or anything like that? The kind of medicine that the parent do not think that this will lead ultimately, if it's continuously used by children, by teenagers, it will lead to addiction.
Yes, in other words, a lot of patients, they don't believe that marijuana is what we call a gateway drug.
Right.
The problem with any mood-altering substance when the brain is growing in a man that's up to 26 years of age,
Sure.
when you have early exposure, you change the brain.
Right.
And you make the brain reprogram itself. So that if I use a little marijuana or a little alcohol and it makes me more comfortable,
Right.
I'm going to repeat that behavior. It's almost an unconscious, predisposed condition. And if that happens, I'm going to find the right drug or the right prescription pill that works for me. And today, as you said, in the last 15 years, people are finding opiates. Opiates can be heroin
Sure.
or manufactured opiates. You know, we have opiates, opioids. The bottom line is pain pills, heroin.
By the way, I don't want to forget about this. Just recently, it was reported in the news that China is exporting deadly drugs to the United States of America and to certain European country, and it's a killer. It's act like a terrorist attack. And as a matter of fact, in the report, they stated that Russian use this kind of drugs to eliminate enemies.
Well,
And the United States of America are allowing the government, or I don't know how it entered the United States.
I think here what happens is it takes time for the government to be able to make something illegal. It comes, for instance, there are manufactured substances that are used to tranquilize an elephant. These are finding their way to the street.
It's called fentanyl, something fentanyl, carfentanil. Something.
And you know, this is simply a strong opiate.
Okay.
And there are manufactured drugs by drug companies that are used to treat chronic pain. And often now, chronic pain is not considered terminal pain, meaning patients that have cancer and are terminal. People with back pain, they develop tolerance, they go to the doctor gives them a stronger and stronger drug that is actually stronger than morphine. So many of these drugs are 3 to 5 to 8 times stronger than morphine. The doctor writes a prescription. They make it to the street.
So you're telling me it's not controlled here in the United States? It's controlled, right?
It's controlled.
And who export it? Is it legal or illegal?
No, when it comes to these other substances you're talking about, kratom is one of them.
Right.
These make their way in because the government has to go through its process where they outlaw it, and so that, for instance, K2 was a synthetic marijuana.
Sure.
They had to go through this process that took at least a year so that they go into gas stations and say this is illegal to sell. There's this, process they have to go through so that a drug that is not considered a drug but a substance that isn't prescribed, it isn't FDA approved, they have to take a different route in order to make it illegal to have or sell. And so it's not always easy for them to do this. What they do is they discover by error. But the bottom line is, is to prevent, as you said,
Sure.
and to treat. So that when these things come, the people that are utilizing these things are the people that already have a substance problem. This is how fentanyl, for instance, gets into the heroin. The
Okay.
people that produce these
They
things,
mix it together.
correct,
right?
and that's one reason why many people are dying. As you probably know, more people are dying from prescription medicine and street heroin
than
than motor vehicle accidents.
Sure,
And so, that's part of why it's considered an epidemic, because this is the drug of choice in this country now, opiates, and that's what people are using. That's what they get from the doctors. And then after a while, they require more. They go to multiple doctors. Doctors are able to figure out how many doctors you've gone to. They can produce something just by going on the computer and find out who you went to for the last year. They have the option of contacting those doctors. Every doctor can do that. So if you come into my office and want a prescription of Vicodin, I can look and see where you've been for the whole year. Then that's a way I can recognize as a physician, you're coming to me, you've gone to 2 other guys, there's a problem here.
Right.
And the doctors are starting to learn how to refer those patients for help, as opposed to being punitive with them. Even the police are now, even across the country, they rather get somebody help than incarcerate them.
Talk, doctor, about let's go back a little bit to our objective is to educate as many as possible from within our community, especially parents. How the parents find out, what indication giving to them in order to find out that there is a problem?
Well, sometimes it's very subtle. The person using a substance are going to deny it, or they're going to minimize it. Even when my mother asked me, "You're smoking marijuana, why do you," when you're a teenager, you think everything is okay.
Yes.
So ultimately, there has to be communication between the parents and the children. And things can be found to be unacceptable. So that I don't have, if you're my child at a certain age, the idea is we have to talk. I have to know what you're doing. If you're drinking or you're smoking marijuana, or you're taking any.
Usually, in general, teenagers do not talk, do not communicate.
I agree.
The majority.
It's challenging.
Yes.
The bottom line is, there's a way to know. Doctors. If I take my child to a doctor just for a physical, that doctor should be questioning. Sometimes the doctor can use a drug screen. We want doctors to use a standard laboratory test called a urine drug screen, which sometimes, if you don't, tells the truth. In other words, you may not tell me everything, but if I ask for a urine specimen, I'm going to know more than you maybe told me. Then I need to talk to you about it, and I need to try and engage you, not punish you, but engage you and try and talk to you about what the dangers are of you using marijuana or alcohol or a prescription medicine.
But I can't tell as a parent if my son or my daughter is smoking because I smell smoke.
Understood.
You know.
Sometimes the only subtle suggestions are poor performance at school, behavioral changes, sleep changes,
maybe secretive
mood changes.
behavior.
In other words, just it's hard to be a detective if we don't have the communication. Sometimes suggestions or signs are how a child's behaving. If their behavior is different, their mood is different, their sleep is different, their school is different, how they're performing in school or a job. Usually with adults, we ask them about problems. Many times they say they don't have any problems, but if you ask them, did you ever get an impaired driving ticket? Did you ever have problems at the job? Did your family ever get concerned about what you're doing, what you're drinking?
But most likely, if they don't come by themselves to seek treatment, they will hide.
That's correct.
The important information,
and
that it will give you indication that he or she is.
And the only
on drugs.
time a person comes for treatment is when a crisis develops. Either an accidental overdose, an impaired driving ticket, being fired from the job. And when they come with their mother or father.
What is the percentage of people, from your experience, you have rich experience and you dealt with so many people from different background. If we talk about teenagers, what is the percentage of those who are willingly, out of their own will, decided to come and seek treatment, as opposed to those who are referred by the government, by school, by courts?
Well, let's just say, that's a tough one. Let's just say that there's at least 35% of kids in school that are actually smoking pot within the last week. How many of them are going to come forward and say, I need help? Very little. Why? Because they don't think they need help.
Right.
And the message they get is that marijuana is not dangerous.
Mhm.
It's the government and the doctors that are saying it's dangerous. They don't understand the larger picture of good health,
Right.
the brain, the growth of the brain, the exposure to the brain, the genetic background. They don't understand all that. So
Right.
usually something bad has to happen, and that's what drives the person in for help. They may not be willing. They may come with their mother. He did poorly in school.
At what point, an individual 17 years old or 16 comes with his mother or with his father or with,
It's typically some type of legal problem or school problem.
Okay.
And so the court may send a person. Even then there's some resistance, but the courts are getting much better now. They're not tolerating not only illicit substances,
Oh, okay.
but if you come and you say, well, I'm on Adderall from my doctor, I'm on Xanax from my psychiatrist, that's a stimulant,
Right.
that's a sedative. Both habit forming, both problematic, both abused, and both diverted.
Sure.
Now, and I'm on Vicodin from my family doctor for a bad back. If you're in the court system, now the courts are becoming wise to that. They're sending those patients to specialists such as myself,
Sure.
and we're deciding whether or not there are alternative medicines for them to take because they're not allowing it. The same thing with a doctor. If a doctor has a problem and he goes into a treatment and he's in a monitored program, he can't tell, well, my doctor gives it to me. My doctor prescribes it. These are words that don't exist in the courts and don't exist for physicians that monitor other physicians and nurses and healthcare professionals. Certain substances cannot be tolerated. If you
Like
have
what?
Well, just like I said,
Right.
a person will say, I'm on Adderall, and
Okay.
there's a lot of people throwing Adderall
Sure.
at kids, and that, the expert in ADHD,
Right.
he'll say, I'm an expert. This guy's got ADHD. Give him Adderall. He'll say, if we don't treat these kids for their ADHD, well, then they're going to use substances later. We say they're too quick to make a diagnosis, and therefore they're giving out this Adderall like candy. And then a patient will come to me who's using heroin or pain pills and say, I'm on Adderall, my doctor prescribes it. Similarly, he'll say the same thing with, now Adderall's a stimulant.
Right.
Think of that as the same as cocaine. If a child is young, he's in the 4th or 5th grade, I don't have a problem with the doctor treating him. But if he's 18 or 19 or 20 or 30 and he says, I have ADHD, I don't believe it. Plus, there are safe medicines to use for that.
Sure.
Similarly, if he's on Xanax or Klonopin for anxiety, adolescents that are in treatment for a substance abuse problem today, when I review the charts, which I'm asked to do, the doctors are giving them Adderall and Xanax, and I have to say, not acceptable. They come into treatment, they can't be on those. Now, who should know that? The doctor. So doctors are part of this problem as well. That's who's putting it into the street.
Can you, for maybe 2 minutes, shed some light about the science of drug addiction?
Yes.
Just a little bit, so as to give our viewers a little bit of information about how it's developed.
Well, what generally happens to the brain is there's parts of the brain. Let's think of the top part of the brain as the part of the brain that makes decisions. It's the green light, red light. It's the cognitive part, the part that tells you don't do that. Then there's the middle of the brain, what we call the brain stem, the midbrain. That's the part of the brain that tells us what we need and what feels good. When we're thirsty and we drink water.
These are in the right hemisphere, right?
Well,
No?
think of it just as top and
okay.
bottom. And there's a little connection between the top,
Top and the bottom,
the
yes.
bottom. And so the bottom is the one that has to do with us feeling good. We have a good meal, we feel good.
Sure.
We read a good book, we feel good. We have a discussion, one of us cries, we feel good. Okay, we're not arguing, we're sharing.
Sure.
So dopamine, it's a chemical that's excreted that gives us a good feeling. A good meal will do it. Other things will do it. Running, jogging will do it. Now, substances can release dopamine. For instance, I use cocaine. Think of a tree with snow on it. When you use cocaine, when you shake the tree and all the snow falls out, when you use cocaine, the brain releases dopamine.
Okay.
What does that do? That makes me feel great. It makes me feel powerful. It makes me feel happy. It makes me feel like I can do 10 things at once.
Temporary.
Temporary. When it wears off, I don't have any dopamine,
Mm-hmm.
so I hunger for the drug.
Right.
Similarly with opiates, narcotics.
Mm-hmm.
I use heroin, I use pain pills, it produces dopamine.
Right.
It goes onto the receptors, and that dopamine is released.
Mm-hmm.
Makes me feel good. It takes away my problems. People have said that if you're schizophrenic or depressed, heroin or Vicodin will make it better. Now, so these chemicals that are released when the drug is in the system are temporary fixes.
Mm-hmm.
You can just be regular, but you'll feel better than regular.
Mm-hmm.
And most people that have used these substances will tell you that. They'll tell you that they kept going after that first feeling they had. Even alcohol.
Mm-hmm.
Alcohol temporarily will give a person who's young courage, reduced fear, reduced shame.
Sure.
Some people feel bad about
Sure.
themselves, but they feel better
Mm-hmm.
when they consume a substance. Now, the earlier I do that, the brain is growing.
Mm-hmm.
What happens is things change in the growing brain,
Mm-hmm.
and the brain resets itself like a computer. So the next time there is stress, the next time there's something that happens, the brain will automatically work in a way where it will reach for that substance to get relief. And it's a progression.
Is this part of, when you talk about this and these are related to teenagers, is it part of the curriculum in the school that
Yes. You have to remember that kids go to school,
Right.
and they have their troubles.
but they are familiar with what you are talking about?
In schools,
In the
no,
school?
they're not.
No,
No, they're
okay.
not. In other words, you got to remember how kids are. Kids
Uh-huh.
sometimes don't know how they feel exactly, but they've been through certain experiences that make them uncomfortable, and sometimes they're not familiar with their discomfort until it's erased.
Okay.
When it's erased temporarily, they didn't know they felt bad. They just think they feel good, and they will repeat that behavior. Now, the part I was telling you about is the midbrain. If we go to the top part of the brain, as you might imagine, the brain isn't grown. So there's not a big connection between the red light, green light.
This is fascinating. We'll continue after this break. أعزائي المشاهدين، سأعود لحضراتكم لمتابعة هذا الموضوع الشيق عن إساءة استخدام الكحول والمخدرات والأدوية من قبل الشبيبة والشابات في المجتمع الأمريكي بشكل عام ومجتمع الجاليات العربية الأمريكية والكلدانية في ولاية ميشيغان بشكل خاص. سأعود لحضراتكم بعد هذا الفاصل الإعلاني، فابقوا معنا. أعزائي المشاهدين، نتابع مع حضراتكم تقديم هذا البرنامج ضيف وقضية، ونحن نتحدث عن إساءة استخدام الكحول والمخدرات في مجتمع الجاليات العربية الأمريكية والكلدانية. ومعنا ضيفنا في حلقة هذا الأسبوع هو الدكتور مايكل فوكس، الاختصاصي في مكافحة استخدام الكحول والمخدرات في مستشفى سانت ميري في ليفونيا. I would like to welcome you back to our show. You were talking about the science of drug abuse, okay?
Yes. Going forward with the science, I was telling you about the brain stem and dopamine and things that drive us impulsively to do things.
Sure.
And the part I was trying to get at, when you're young, the cortex, or the part of the brain that makes decisions, tells us go, stop, like a red light, green light.
Sure.
It's not developed, the connection, which is why teenagers are so impulsive and they do things without thinking.
Oh, it's not developed yet
No.
for teenagers. At
Correct.
certain age it will be developed, right?
Right.
Okay.
So for a man, it's 26. For a woman, it's younger.
Okay.
So what that means is the executive function, the rational thinking,
It's not there
is
yet.
not there yet. And as this condition progresses, it doesn't develop.
Okay.
And so what happens is a person may know this is dangerous and that they could die, but they do it anyways. And so the earlier you start, the greater risk you have, especially if there are genetics and problems in the family, what we call dysfunctional family. Dysfunctional family can mean anything. It can mean a divorced parent, a deceased parent, a missing parent, abuse. Any one of those things can produce trauma, can produce any type of pain. And so this pain is eliminated with exposure to a substance. And it's buried, and it doesn't come out until treatment is effected.
And treatment, the earliest it comes, the easier will be the result and the more positive.
Yes, we always want two things. We want, of course, less harm, less destruction, and of course, This is considered a disease like diabetes, and it is treatable. Treatment is effective, and we have wonderful tools to treat people, especially with opiates.
Let's go back a little bit about the parents in general. What is the right approach by giving parents to their children if they find out or if they suspect that there is a problem? What should they do?
Well, first of all, it shouldn't be a punitive thing. It shouldn't be considered right, wrong, bad, good. It should be considered unhealthy, dangerous.
Okay.
Let's get some help. Let's get some counseling. Let's see a professional. And there's many places in the community where people can get help, and the right people can then get you where you need to go. There's community mental health where
all over the Tri-County area.
Yes. So you don't have to have any type of
What
insurance.
do you say, doctor, to parents who overreact when they find out? They get angry, no communication whatsoever, they just react.
It doesn't work. It doesn't work. There's already a little bit of a problem. There's already secrets, and there's already distrust. And so this is something you want, because it really, the family is affected by this condition. So if I have a child that is going out and using substances and getting into trouble, I can punish her and ground her and watch her, but in reality I cannot fix her. But what that produces in the family is a lot of problems with the other family members. They say that the family member is as sick as the person with the disease of addiction, because it causes a lot of disruption in the family. It's better to go to professionals. They're everywhere, and they can direct the person where they need to be, what level of care they need, the person that's using the substances. The sooner the treatment, the better, because there's different levels of treatment for different levels of the disease.
Talk about the process of treatment, and how long does it take, and who is the best candidate among teenagers to pass that stage and to become comfortable and to be cured?
Well, for instance, in high school, one example, if a person starts experimenting with drugs, they have programs where the parents and the child go for maybe two times a week, once a week for about 6 weeks, where it's actually educational. In the room, there might be, say, 6 to 8 to 10 families. In other words, 1 or 2 parents and the child, and those groups might be 5 or 10 in the room. They get education. They get these little exercises where they get to look at certain issues. And when that program is over, the person can actually make a decision whether or not they want to continue what they're doing by the process they just went through. So this is the minimum type of outpatient treatment for substance abuse. There is counseling, which is sort of at a level where you may see somebody once a week. It's certainly better than nothing, but sometimes education is important. It's very important to become educated in these groups.
The same concept and principles utilized by you and those who are professionals helping you at the treatment center is used to treat alcohol abuse and the drug abuse? Or you have different...
Yes. In our world, it doesn't matter what the person's using or how often or what they're using. It doesn't matter what they're using or how often. Usually, what it comes down to is what do they need. In my world today, most of the people I see have been having a problem long enough where the preventive measures never happened, and that their condition has escalated to the point where now they've lost control of a substance. It could be alcohol. Most of the time, half the time, it's opiates. It could be pain pills, it could be heroin, it could be both. Not uncommonly, there's another drug involved. It might be a tranquilizer, Xanax or Klonopin from the doctor. So for myself, we have to detoxify them. We have to get them off the medicine. We have medicine to do that. We have medicine to keep them off the medicine.
This is prior to the education part? Or
this is in addition to the education.
Do you use the 12 steps?
Yes, we do. Yes, we do.
And you apply it, as we said earlier, to every person who have
Yes,
this
we
issue,
prefer. So if a person becomes dependent on a substance and they need what we call medical detoxification, sometimes it could be done outpatient, Sometimes it needs to be done inpatient, depending on the various factors. For instance, if there's a co-occurring mood disorder, there's a good percentage of people that have two conditions, addiction and depression.
Right.
Sometimes that puts them at higher risk for recovery, and sometimes we need to treat them at a higher risk level of treatment. So as opposed to outpatient, it might be inpatient. The duration of stay varies. It may be 5 to 6 days. Most insurers now won't pay for 30 days like they used to back in the 80s and 90s. But from the inpatient, they go to intensive outpatient. So what happens is they're detoxed from their medicine. They may be on a maintenance medicine, which is not uncommon today and very effective for opiates. While they're on that maintenance medicine, they go to what we call intensive outpatient. What that primarily consists of is an hour of education, an hour of group therapy. So an hour and a half. So you have 3 hours, 3 times a week for 4 to 6 weeks where the person does this, and in conjunction to that, they go to 12-step meetings.
Okay. How does the treatment evolve over the years? Is it now currently different than 5 years ago, or it's
Not
the
really.
same?
No,
Not
it's
really.
it's the same as it's really been this way probably since the late 80s, 90s. In other words,
But the rate of success is not that great.
no. The rate of success today, opiates are different because there's different philosophies about opiates. There are some that think you should be on nothing. There's many that think you should be on some type of maintenance because relapse occurs 70% of the time unless a person is involved in a structured aftercare. That's treatment, that's rehab. So let me give you an example. The sickest person, which we find is a physician or a nurse. That nurse may be injecting Dilaudid, the doctor might be drinking every day. We find those patients do the best because they're willing to belong to an aftercare program that lasts 3 years. And what do they do in that program? Group therapy. After the initial inpatient and outpatient, once a week group therapy. They go to a specialized doctor so that they don't end up on prescription medicine that they're not supposed to. In other words, they can see their own doctor, but they have to go to an addiction specialist every 3 months to be sure they're not on the wrong medicine. And if they are, they're told to stop working. And of course, they have to be drug screened randomly. They do better than anybody, and the reason is they're committed to aftercare. Now, if you come out of a facility, say Brighton Hospital or Maple Grove or St. Mary, if you come out, a lot of people think, and families think too, once he goes for treatment, he comes out, he's cured. No, this is like diabetes. And sometimes it's like diabetes and insulin. Sometimes you have to check your sugars, give yourself insulin for a long period of time, especially while you engage treatment. And you have to adhere to that structure. Now, if a person walks out of Brighton Hospital and is not given maintenance medicine and or does not adhere to continued aftercare treatment, there's a 70% relapse rate, very high. However, if a person adheres to that program, they do very well.
When you talk to people, individual teenagers particularly, who do not like to be in a treatment center with a group, they would prefer to be on an individual level. Would you entertain this requirement by the individual?
It is preferred because we want
it is
that
preferred what?
To be in a group.
In a group.
And I do know there are patients that that are not comfortable in a group.
Right.
And so that already eliminates 12-step program.
Sure.
It eliminates group therapy, which is difficult because we don't want that individual to think that they're alone because they came to us alone. These patients that have this condition have become isolated. They're by themselves. They're like an onion.
Have you ever experienced people like this?
Many times.
And the rate of success, is it better or? They say, you know, when you are in group, it's better for the professional because they produce good result as far as money is concerned.
No.
You know, because you have 20 people as opposed to spending 2 hours with 1 or 2.
Let me say this. Reimbursement for these things, very poor. Okay? I don't think
I like to talk about the insurance because there are so many teenagers that don't have insurance.
Let me say this. The ones who don't have insurance get the best treatment because community mental health, you know, the only problem I have with them is some of the psychiatrists that work for them.
Right.
However, if you leave the psychiatrists out and you got the social workers and the therapists in and the group, and 12-step meetings, they do great.
Why the psychiatrist?
Because
what is it?
Psychiatrists, and I'm not afraid to say it, there are many that prescribe inappropriately. Okay, so I may have a patient who's alcoholic, who goes through the community mental health
So the
system.
difference between you and the psychiatrist, you believe in education and awarenesses, right? And
let me clarify. We both believe in treatment. And what I'm saying is, a person may have depression and addiction.
Okay.
So we have a guy who's gone through treatment for alcohol, and he has depression. Well, when he goes through the system, community mental health, he gets great treatment, longer treatment, which is good. But that has to usually include a psychiatrist, because the perception is you need a psychiatrist to treat addiction, which of course you do not. You only need the psychiatrist if the person has a co-occurring depression problem. But the problem with the psychiatrist is sometimes he will introduce a medication that is absolutely unacceptable to the addiction doctor. Because we're regularly taking people off the medicine that the psychiatrist gave them in the first place.
And they don't leave you alone. One of the major requirements for any center to have the treatment center, they have to have a psychiatrist.
They got to write a prescription. Right, they have to have the psychiatrist. And the psychiatrist, when he sees you, says, oh, I got to give you this. Now, we tell the patient, do not take anything until you check it with us. Because the psychiatrist almost seems to be in another world when it comes to prescribed medicine. We cannot get them to get on the same page of what we don't want the patient to have. That's the only flaw. Otherwise, no insurance is better than insurance, because insurance is restrictive. But community mental health with no insurance is very good, because they're funded, and the only problem...
When you say community mental health, anybody can be accepted as long as they live in a certain area?
Yes, yes. The counties
like Wayne County?
Yes, Wayne County, Oakland
Anybody
County,
who resides in Wayne County, he or she will be eligible for a treatment as long as what? You know,
indefinitely.
If he does not have Medicaid or Medicare.
Medicaid, with Medicare they won't be accepted. With Medicaid, they will. With no insurance, they will. If you have any type of insurance or large deductible, you won't. So it's for patients that are have no insurance or Medicaid, which is close to no insurance, because those are the patients that are entitled to get treatment. And even all insurance companies are supposed to not discriminate and have programs for people that have substance abuse disorder.
But there are so many treatment centers that are reserved for the elite, for certain segment of the society that they have money, rich people.
No, what happens is they don't accept Medicaid. That's what happens. And you know, there are people that will sometimes pay cash, but it's too expensive. So whether it's you know, in other words, they'll want $5,000 for a short period of time, but you can get around that if you're without insurance to go through community mental health, because you'll get the same treatment.
Really?
You'll get the same treatment. For me, $5,000 is very expensive to stay for 10 days. And you know, they'll be as high as $30,000 for a month, $20,000 easily. Whereas that's you know, that's unacceptable. But without insurance, it's been my observation, you could get better and longer treatment. You know, you just you know, have to be careful about, you know, who you're seeing as part of that treatment, because you have to have that basic understanding that you want to be substance free. Now, certainly there are substances we use for opiates and heroin that help people engage in treatment, because if you just put a person in treatment, you detox them with some of these medications for 3 days, and then keep them for 7 days and send them out. They will have this is the science part of it, they will have problems with their brain, whereby they will crave and hunger and relapse within a month.
Do you see any difference between the treatment of person from ethnic background, like Arab American or that, for that matter, Chaldean, and the mainstream individual?
I don't, but sometimes I've had the impression that it's a more secretive kind of thing, that there might be, as you mentioned earlier, a shame associated with it, which is sad to me.
But you said almost everybody is in
everybody is like that. The person that has the problem is shameful when they shouldn't be. It's like me being ashamed that I have diabetes. But the family is also shameful in the same context. Whereas it's a disease. It's a genetic disease, and you know, that's how I look at it.
Sure.
But other people don't look at it. Even physicians don't look at it that way. You know, physicians can sometimes be judgmental. And I tell a patient, if you go back to your doctor, who we send them back to, you know, is disappointed with you, if you will, because this happened to you, you have to find another doctor. He's uneducated. A doctor should be happy you just underwent treatment and supportive of this.
Unfortunately, doctor, we run out of time. We took even more, 3 minutes. And I would love to, I have so many questions for you. And I would like maybe in the near future talk about the treatment in detail from A to Z.
I would love that.
And we will invite you again, and we will talk to St. Mary to have them maybe participate in certain kind of campaign for education in our community. Thank you very much.
Thank you.
And hopefully we'll see you again.
Okay.
أعزائي المشاهدين، شكرا لإصغائكم ومتابعتكم، وحتى ألتقي معكم في الأسبوع القادم في حلقة جديدة من برنامج ضيف وقضية. لكم مني ومن أسرة البرنامج أجمل تحية، والسلام عليكم.